Hi everyone, this is Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. We have here a patient who attended with bilateral, fully occluding earwax, and they've been suffering now for a fortnight or so. And during this time, they've tried to soften and remove the wax using home olive oil, and their symptoms, in fact, worsened, and they visited their GP, who advised them to get their ears cleaned. Now, in the UK, many GP services, clinics, surgeries are no longer offering ear care as a standard treatment. So the patient essentially had a couple of choices. They could wait between 12 and 18 months and be referred to secondary care in the NHS. So that's at the hospital, at the ENT department, where they'll can see an ENT nurse or registrar to have the wax removed, or they can go private and see someone like myself. And the patient was recommended, if they wanted to go private, to come see myself. And I think it is a great shame that the NHS is no longer offering ear care. I know there's a lot of bureaucracy and red tape and lack of funding and resources, but it'd be I think it's a growing issue, and that many people now in the UK are suffering from earwax impaction, like this gentleman, and they try and remove it themselves, either by using drops or DIY ear syringe, and it can make their symptoms worse. Not everyone can, of course, afford to go private. Growing up, I know we weren't very wealthy at all, and I would have struggled to have gone private to have my ears cleaned. So putting business aside, which obviously it means there's an uptake of business for people like myself in the private sector in the UK, but I do think the NHS has somehow got to revisit ear care as a really important procedure and reintroduce it back on the NHS in primary care, where patients can be seen at the local surgery. But there is a lot of bureaucracy and, unfortunately, lack of resources and funding. So I can understand why a lot of GP practices have decided not to offer it. So what you'll see, we've removed this blockage. This patient has overused the olive oil, and it's just caused the ear to be very damp and wet, very greasy. It's going to dry up. The patient just needs this to naturally dry up. The eardrum, this a lot of scar tissue on the periphery. I wouldn't say it's a textbook normal looking eardrum, but there's a bit of scar tissue there. Maybe possibly had some trauma in the past, and past ear infections. Same patient, this is their right ear. This ear was actually even more blocked, although they felt their left ear was the worst. There's a tremendous amount of wax, humongous pieces, sizes of wax came out from this side. This side, the ear canal was slightly more narrower, and it was a bit of a struggle to extract the larger pieces of wax, which is more medially located towards the eardrum. As I brought it forwards towards the entrance, the wax plug was larger than the aperture of the entrance of the ear canal, so I had to use a Jobson horn and scoop it out in the end. Because they've overused the olive oil, it can make the wax really soft, and therefore it can block the suction probe, which is happening quite a lot on this side. I was contemplating to put some fresh olive oil spray in the ear just to bind it together again. Oddly enough, if you've got really mushy wax like this, that can be caused by olive oil as well as other drops like hydrogen peroxide and sodium bicarbonate. If you use olive oil during the procedure, it temporarily helps to bind the wax together. And the patient reported that whilst they were using the drops, their symptoms got worse. And the reason for that is a wax plug, its core, its meshwork, its structure is made up of a matrix of dead skin cells, exfoliated skin cells, and debris and loose hairs in the ear. So that's what forms the scaffolding of the earwax plug. And then what coats that scaffolding are the natural fatty oils, so sebum secreted in the ear, and an oily sweat, the same sweat we find under armpits. So these oils that are secreted in the ear, those oily fatty secretions and sweat, they then fill in the gaps of the matrix, the scaffolding created by the dead skin cells and hair strands in the ear. And when you introduce olive oil, if you've already got wax in and you put more oil in, it will soften it, but it will also coat that matrix and actually enlarge the wax plug. So it wasn't surprising to hear when the patient advised me that their symptoms got worse, because it softens the wax plug, yes, but the oil will just coat this wax plug. It's like another veneer, another lacquer, and it will get bigger and bigger. And if you are going to use medical grade olive oil spray or drops, and we do sell it just in the UK. I'm a healthcare ambassador for a company called Clear, who have a full range of ear care products. If you visit our website, the URL's there, www.clearwax.co.uk. It's also in the description. And if you visit our public online shop, we only sell to in the UK, so do be aware. We sell a medical grade olive oil spray. If you use that on a regular basis, say a weekly or fortnightly basis, once the wax has been removed, there's a possibility that the oil can help to wash away the wax, so, as opposed to using water, which is bad for your ear. Using medical grade olive oil, because our ears already secrete oils, and olive oil is slightly acidic, so our ears are slightly acidic, so it's a similar pH, and the acidity is important in the ear. It helps to repel harmful, or should I say inhibit harmful bacteria and fungi reproduction and growth. If you use it on a weekly or fortnightly basis as a preventative measure, it may soften the wax and drain it. So you tilt your head over the ear that you want to put it in. So if it's your left ear, you tilt your right ear over towards your right shoulder, so your left ear is facing the ceiling. You can squirt couple of aliquots of olive oil into the ear, let it soak, let it penetrate, let it soften any wax that you may have, and hopefully it's not a lot if you're doing it on a regular basis. And after 5 minutes, tilt your head over to the opposite direction, let it drain when you put a tissue underneath. That eardrum, you can see that white plaque there, and actually that's tympanosclerotic plaque. So it's scar tissue, calcification, calcium deposits have formed into a plaque, and it's just on the hammer bone. Well, I hope you enjoyed that video, guys. You just saw a still image there of all the wax that I removed from both ears. Take care, keep well, and speak soon. Bye.